So an IUD is the best option for you. Let's talk about what that insertion looks like. Let's start with a little bit of anatomy. When I look at your cervix, what I see is something that looks like a donut. It's round, it has a hole in the middle. That donut hole is what communicates to the inside of your uterus, the place where your IUD is going to sit. Remember, your uterus is a muscle. Inside that muscle is a cavity or a space. That's the space your IUD is going to sit in. When we insert an IUD, the very first thing we do is a pelvic exam. A pelvic exam is when we put 1 or 2 fingers on the inside of the vagina. That helps me know what size and direction that your uterus is facing. That's really important for me to understand how I'm going to be placing that IUD. Next, we're going to place that speculum. That speculum is what goes inside the vagina and helps me see that cervix, that donut hole. Nobody loves a speculum. It does feel like pressure, but the speculum shouldn't hurt or pinch. So if it does, please make sure you let your provider know. Once I see that cervix, the next thing I'm going to do is use an instrument called a tenaculum. The tenaculum is going to hold that cervix nice and still. The tenaculum can also be uncomfortable, but it is an important step. Now, your IUD, even though it looks like a T, it's going to come loaded in a tiny little straw. And that straw is what's going to pass through that donut hole into your uterus. As we pass through that donut hole, you are most certainly going to feel some kind of cramp. Everybody feels it differently. For some people, it's a little cramp. And for some people, it's a really big cramp. Everybody's experience with IUDs is very different. I'm now going to hold on to that cervix, making sure that it's not moving away from me. I'm going to place that straw into the uterus until I feel the top of your uterus there. When I gently touch the top of your uterus, you might also feel that too. Once I do that, I'm going to release the IUD, pull the straw out, and leave that IUD right here at the top of your uterus. Remember, an IUD has a string that sits outside of your cervix, but not outside of your vagina. It's nothing you can see or feel on the outside, and after a little bit of time, it's nothing your partner can feel either. It does take a short amount of time for those strings to get nice and soft from normal vaginal secretions. Like I said, some people can breeze through this insertion with very little or no pain at all. But for some people, this experience can be uncomfortable or even painful. If you are worried about having a procedure that might have some discomfort, or you've had a negative experience before, please remember, you should feel empowered when you're choosing your birth control method, not like it's going to be a traumatizing experience. If you think you need a higher level of sedation, please let your provider know. There are definitely options available to help make this a comfortable experience so that you leave with the method that's best for you.